Hello, my name is Jonathan Van Nuys. I'm the study clinician from the UCSF Invite Home Study, and today we're going to be going over how to inject lenacapavir step by step, and this is your checklist. So first, we'll talk about the materials that we need. So you should receive a box of lenacapavir, and step one is to verify the prescription, ensure the box contains lenacapavir, and that the name on the kit matches the person receiving the injection. Inside each box should be two vials of lenacapavir, two syringes, two withdrawal needles, and two injection needles. So now we're going to gather all of our materials together and organize them. So we will have brought you gloves, alcohol swabs, sterile gauze, sterile pad, adhesive bandages, and a sharps disposal container. And you'll also have the lenacapavir injection kit. Choose a nice, well-lit area where you can set up a clean surface and assemble all of your supplies. And then you want to inspect both the vials. Check the expiration date. It's right there on the bottle. It's also on the box. Don't use them if they're expired. You want to ensure the medication is yellow and free from particles or discoloration. If you notice any abnormalities, do not use it. Let me know. And then very important for infection control, anytime we're doing a procedure, wash your hands well and put on gloves. You can, at this point, consider applying ice before the injection at the injection site to reduce pain. So now to prepare the injections, remove the vial cap, vigorously wipe the rubber stopper with an alcohol wipe, and don't allow anything to touch the rubber stopper after wiping it. Now we're going to attach the pink needle, the 18 gauge 1.5-inch pink withdrawal needle to the syringe, and it just screws right on. And then we're going to inject some air into the syringe. So draw back 1.5 milliliters of air, and I'll show you how to do that in person, but basically you want to have the top of the rubber stopper shown there and pull it even to the numbers on the vial that say 1.5. And then holding the vial on a flat surface, insert the needle into the vial with the rubber stopper and fully inject the air by depressing the plunger fully. Now turn it all upside down, and you're going to slowly drop the dose and just withdraw as much of the medication as possible into the syringe. It's okay if there's a bit more medicine than the dose. And now you can unscrew that withdrawal needle and put it in your handy sharps container nearby. We're going to replace that needle with the gray injection needle, and that's a 22 gauge needle. It screws on just the same, also very easily. And now we're going to prime the needle. And again, I'll show you how to do this, but you're going to slowly push up that liquid until you get the top of the rubber stopper to the 1.5 milliliter line, getting rid of any excess medication or air bubbles. You can do this over a sterile pad. You can do it over the sink. And now we're ready to administer the injection. So you have a couple choices for injection site. So the abdomen 2 inches from the navel is the recommended site. You can see that area in blue there. Alternatively, you can do thigh injections if approved by your provider. You want the two injection sites to be at least 4 inches apart and to be a site that allows you to pinch enough skin to inject the medication. So areas with more body fat can give you more skin to pinch. And now to prepare the site, take one of your alcohol wipes and clean the injection site in a circular motion, moving from the center outward, and allow it to air dry. Now gently pinch a broad portion of skin at the injection site. Make sure the pinch is gentle to avoid injecting into compressed tissue. And then to inject the medication, so a 90-degree straight up and down angle is preferred to help you get into the subcutaneous layer shown there. 45-degree is acceptable for a thinner person if you need some more of an angle not to get too deep. You want to take it slow and steady, depressing the plunger into the solution to inject the solution. Lenacapavir is a thick solution, so you're going to have to use some muscle. Inject at a slow and steady pace until all the liquid in the syringe is fully dispensed and the rubber stopper is all the way down. Now withdraw the needle at the same angle that you inserted it. Engage the safety mechanism, not pictured here, but you can do it against a hard surface. You'll see it on the gray needle, and immediately dispose of it in the sharps container. Now take a look at the site. Once in a while, there might be a little bit of blood, a little bit of medication. You have your gauze there, so apply pressure to the site as needed to reduce any leakage of solution or bleeding, and then you can apply a bandage if necessary. You're going to repeat all of those steps for the other vial, and remember to inject it at least 4 inches from the first injection site. So after the injection, again, icing before and or after can reduce pain. If you're really having injection site pain, you can also either pre or post dose with Tylenol, ibuprofen, if agreed upon with your provider. And just a note, a nodule, like a hard bump, may be felt under the skin by most, but not all people after the injection. This may last several months. And actually, this is what's called a depot that the medication forms and then it slowly releases medication from there over the 6 months. So it's quite normal to feel that. Thank you. And if you have any questions, please contact us at invite-home@ucsf.edu, or you can call us at 415-294-0609. Thank you.